Have you ever questioned what and who a medical director can be for your aesthetic business in your state? Well, on this video, I'm going to dive into the role of a medical director and why you actually need them. First of all, let me preface it with my apologies for the shadowing, but the sun is going down and I'm trying to knock these videos out, so y'all just gonna have to bear with me. I don't have a camera crew. First things first, let me introduce myself. My name is Dr. Kiiyonna Jones, and I am owner and founder of Luxe Beauty and Wellness Boutique and Luxe Beauty Academy, and I help healthcare professionals enter into the aesthetic space, but more importantly, charge their worth, add tax, and get that time and financial freedom that we all deserve. So today's topic is one that I also get asked very often, and that is about what a medical spa requires from a medical director. Because we talk about nurses and RNs owning med spas, we talk about NPs owning med spas, and even PAs owning med spas. But what is the role of a medical director, and technically, why do we need them? Something that I want to make sure, especially on my channel, that I communicate to my followers and my subscribers, I should say subscribers on here, my subscribers, is that a medical spa, med spa, aesthetic business, medi-spa is a medical practice. And as a result of being a medical practice, it has to be led by a medical practitioner. Now, states decide who the medical practitioner can be, but I can tell you unequivocally who is not, and that is a registered nurse who is not advanced practice. So it has to be led and overseen by a medical provider. Now, in some states, that can be a nurse practitioner and a physician or a physician assistant, also a doctor of osteopathy or a medical doctor, and even some states allow dentists. But I can tell you that whoever is allowed to be your medical director, just understand that they are responsible for every single medical patient. In this case, it doesn't matter if it's aesthetics, it's still medical, right? They are responsible for every patient that comes through that door. And even though in a lot of cases they are not required to be on site, they should still be involved with every aspect of the medical decision making for that patient. Now, you probably wonder, okay, Dr. Jones, well, how can they be involved in every aspect of the medical treatment for a patient if they in a lot of cases they don't have to be there? Easy, through protocols and standard operating procedures. That's how. And so every single standing order or standard operating procedure or protocol must be reviewed and also must be signed by the medical director. Okay. Now, what I want you guys to understand is that every patient who comes through, especially a new patient, they must have a treatment plan from the very beginning of their treatment, not after they're treated, but before they are treated. And essentially what's happening is the medical director is basically clearing the patient to say, yes, we have assessed them, they've met the criteria to receive this medical treatment, and here's a treatment plan that I recommend. Now, from that point, the nurse can follow, based on the protocols and standard operating procedures, that treatment plan. Now, a lot of people make the mistake of assuming that, oh, well, if I can collect the data as a registered nurse, then I can just, provide the treatment. No, you cannot. That is the fine line between not practicing medicine and practicing medicine. Now, if you have a new patient, and let's say you're doing your intake for assessing the patient, as a nurse, you can collect the data. That's fine, but you can't interpret the data. The medical director or supervising physician is the one who is able to interpret the data and determine a treatment plan, not you as a registered nurse, okay? Nurse practitioner can interpret the data and come up with a treatment plan. Now, if the nurse practitioner is in a restricted practice state, they simply need to have generalized protocols to follow that is set forth by the supervising physician. That's the only requirement. If in fact they are in a restricted practice state, it is still within their scope of practice to assess, diagnose, and treat patients, and even prescribe for patients. So they don't require as much oversight as registered nurses. Now, with that being said, if they are in a full practice state, then they can do it all as long as they are permitted to be a medical director for an aesthetic practice. That is very important. Another mistake that people make that I want to talk about is the assumption that any doctor can be your medical director. Now, I want to break this down so you understand it. I don't know if you guys know this, but I have a background in academia, so I was faculty for 11 years. So it's important for me that you understand the why. And if you understand the why, you'll always be able to make decisions based on that. And so when it comes to medical directorship or supervising physician or even collaborating physician, the reason why it's not a one size fits all, because I'm going to give you a scenario to explain it. Let's say, for example, I own a med spa and I have a medical director, but I am offering treatments such as hormone replacement therapy. I'm offering sclerotherapy. I'm trying to think of stuff that's like non-traditional, PDO threads, right? My medical director has to, in order to supervise appropriately, right? In order to meet the regulations set forth by the state, they should have experience in that and they should have been trained. So how can a medical director approve protocols, write policies and procedures for the administration of these treatments if they have no experience or training in them? It makes no sense, right? And so a lot of times people make the mistake of assuming that, oh, if they're a medical doctor, then they can. And they can, they just have to get the appropriate training for it. So make sure that whomever is your medical director, even if it's a nurse practitioner, physician assistant, if they're able to do it in the state, that they have the experience, because they bear all the responsibility for every single medical procedure in that spa. Okay, even if you are owner, like for example, in my case, 49, sorry, I'm at home, you guys, and that's my daughter, 49, 51% ownership. My medical director has 51%. I have 49. Even in that case, as a nurse practitioner, and we are a transition to practice state, it does not matter. He still needs to have the experience in order to supervise me, even if it's only through telecommunications. And another thing is you need to make sure that they have a level of communication with you, which is the last thing I'm gonna talk about. I'm trying to keep it to 8 minutes, y'all, less than 10, but I'm not there yet, but I'm almost. Here's why I want you guys to know that. And sorry for the noise in the background. I'm gonna make this quick. You have to understand that your medical director is the supervisor. You're not paying for their license. You're not renting their license. This is a medical practice, and I cannot emphasize that enough, you guys. You do not want to put yourself or your medical director in any position where they could potentially lose their license. They are in partnership with you, yes. They do have oversight though, and they are responsible for these patients. Therefore, if you have a medical director who you have not spoken to in a year, 2 years, there's no way that they can actually supervise you if there is no communication. That is essentially you renting their license. You cannot do that. That is illegal. Okay, so they have to be involved. They have to delegate the treatments, and they are the ones who have to be involved in the hiring and the firing of the medical team because of that level of responsibility. So again, you guys, I just want to make sure you understand the purpose of a medical director. It is always about the safety of the public and not about you. Sorry to tell you, it's not about you, it's about the safety of the public, and you as a practitioner, restricted practice, reduced practice, whether you're RN or not, you have to meet the regulations that's set forth by the state, okay? And it has to make sense. It would make no sense for your medical director to be an internal medicine doctor with no background in aesthetics, never taken a training, no certificate at all. Then they cannot be supervising you. that's the case, right? They have to have some experience so they can train. They can take training. They don't even have to necessarily practice. There's nothing in black and white that says like, oh yeah, they have to take training and then they have to practice for 5 years. Nothing like that. But they do have to be able to have a level of understanding of the treatments that they are supervising and they're ultimately making decisions about, if that makes sense. So again, you guys, thank you guys for tuning in. I hope that I have added some value. If I have, please go ahead and click that subscribe button, hit that like button, and don't gatekeep. Share with your friends and comment below if you have other questions that you want me to answer on any of these videos. I absolutely love doing these videos, but like I said, I'm trying to get it down to 10 minutes because I don't want to keep you guys. That way you get bite-sized pieces. Again, any questions, comment them below. Thank you very much for listening all the way through. Take care. Bye.